Good morning and welcome to our Facebook Live presentation, What to Know Wednesday. So I am Melanie Garland and I am joined by my two lovely co-hosts this morning, Miss Susan Spilly. Good morning, Susan.
Good morning.
And Megan Rogers. Good morning, Megan.
Good morning, Melanie and Susan.
All right. So we have one of our favorite topics really to talk about because we like everyone to know about Medicare's preventative services because your personal health is important and learning about what you can get that's covered by Medicare for that preventative care. And it's usually free services. So that's always fun to learn about as well. So Susan's going to talk about that for us today. But before we get right into the presentation, I do want to let you know that if you have any questions or comments, for us today, please put those in our comment section of our video. We will be monitoring that during the live presentation and then after it's recorded as well. We will be checking that from time to time. And all of these presentations, even though they are presented in live format, we also save them for later viewing. So you may be watching today and thinking of someone that could also benefit from this information, and they can just go to our Facebook page under our live video section and they can find this recorded video there. And also we have a YouTube channel. So you just search Indiana Ship and you'll find our YouTube channel, and these videos make their way over there as well. So ladies, without further ado, I think we'll dive right in.
Terrific. Thanks. I just also would like to mention that we also have a women's specific preventive services presentation that Megan will be doing later on this year or early next year. So ladies, if you want to learn about some very specific, a little more in-depth information about preventive services for us, then check us out and tune in. First, the SHIP commercial. SHIP is a free and impartial counseling service about Medicare and all the related insurances. We're funded by the federal government, specifically the Administration for Community Living, and here in Indiana, the Department of Insurance. We have all kinds of counselors scattered across the state that can help answer your questions about Medicare's preventive services and all the other Medicare questions you may have. Let's talk about what is preventive, or some say preventative care. It's all the stuff we need to get ahead of our healthcare issues. Sometimes you might think you have a little something, but if you don't get it checked out, it could soon become a big something. Also, some diseases and conditions have no symptoms. So if you don't get the tests and the screenings, you'll never know until things kind of blow up. They can include, of course, examinations at the doctor's office, all the labs and tests, blood and other bodily fluid tests that can determine or detect if things are awry. Medicare has always covered some preventive services, but since 2010 in the Affordable Care Act, they have really blossomed with the array of preventive services that are covered, and they made so many things that are at no cost to the beneficiary. That means you don't have to meet that Part B annual deductible. You don't have that 20% coinsurance. But it's really important that the providers you go to accept Medicare assignment, which means they accept what Medicare pays for that preventive service. If your provider doesn't accept Medicare assignment, it's possible that you could have a little bit of a copay. So it's always best to check that out first so you don't get any surprises. But please don't let that stop you from getting your health checked out. Generally speaking, under Medicare Part B, which is the medical part of an outpatient part of Medicare, they cover vaccines that are done in a doctor's office, all the health screenings that we'll look at, and counseling and education. That's really important because sometimes we just don't understand how things work, but a healthcare professional can help us have a better understanding. All the tests and labs and exams that can detect disease. If you have a Medicare Advantage plan, which is Medicare's option for managed care services, you need to make sure that your provider is in network with your plan. Some plans have out-of-network coverage, but you may pay a little bit more. And some plans don't have any out-of-network coverage, in which case you'd pay the whole thing. So it's really important that you keep up on if your providers are in your Advantage Plan network. But they should also cover all of these preventive services, and most of them are for no cost to you. Here is a list of services that are covered 100%. Every year, people who are on Medicare get a yearly wellness visit. And this is something that is not a physical. Medicare still doesn't cover physicals, but it's a consultation session with your primary care provider, talking about all the preventive services that he or she thinks you need in the year coming up. Now, if you're new to Medicare and it's been less than 12 months since you've been a Medicare beneficiary, you get a welcome to Medicare preventive visit. And this is mostly the same thing. Now, I always tell folks, you know what happens every time you go to the doctor? They'll take your blood pressure and they'll probably weigh you. So those things will probably occur, but generally speaking, these are hands-off sessions. You can see there all of the options that people have. Now, not everybody needs all of these. Let's take, for example, a mammogram. Mammograms are for, under Part B, under preventive services covered at 100%, are for women. Men get mammograms too, but that's only if they have something going on. And that wouldn't be a preventive service. That would be a service that they would get to diagnose. So there would be subject to the copay and the deductibles in Medicare. But women can get regular screening preventive mammograms, the frequency of which is really determined by your doctor, not Medicare, not the government, but your doctor, depending on your personal situation. And that's true for colorectal cancer screenings. Most people at certain age get regular colonoscopies. And again, the frequency of colonoscopies depends on what your doctor thinks is good for you. Depression screening. I know some of my friends who are on Medicare will tell me that their doctors asked them these weird questions about how they were feeling and their thought process. And they kind of felt like they were being tested for dementia or forgetfulness. And, the doctors will probably slide those things in. I've heard, and ladies, you can fill in here, I've heard they have them draw a clock. They have to remember 3 words and then later repeat those 3 words. So I'm not on Medicare yet, but when I do get my Medicare preventive visit, I hope I don't flunk the dementia screening. Have you heard of other maybe clients or your folks telling you about preventive services?
Yes, I know I've seen those dementia assessments. My mom's nursing home did it quarterly on her. And she got smart and wrote down the 3 words that you have to remember because they use the same words every single time. And she had it on a little hospital table that she had at the nursing home, and they didn't realize that she had it written down. And she looked at them. And you also have to count backwards by 7s. So I am going to flunk that one. You better start practicing, Susan. Melanie, you got any stories?
I don't have any stories quite like that, Megan, but I have heard about the 3 words, and I do think that is a very common one. And it is I think it's very helpful, that during those annual, wellness visits, that different things and different screenings are kind of added into that. And I think it's a good way to touch base with the patients and try not to miss some things that may be going on, especially if it's just that you may see your doctor once a year. So I think it is a very helpful thing.
Yes, thanks, gals. I guess I will have to start practicing counting back by sevens because I'm going to flunk that too. Continuing on, now we're talking about Part B, preventive services. And remember, these are largely outpatient, but provided in a facility. So many of us get our regular flu shots and our regular COVID-19 vaccines. Some people get the hepatitis B vaccine, and these are mostly done in doctor's offices. Now, I know I have gotten my flu shot and COVID-19, all those vaccines and boosters at the drugstore. But if I were on Medicare, that drugstore would have to be a Part B provider. So again, just make sure that wherever you're getting your vaccines, that they accept Medicare Part B for these kinds of preventive services, or under your Part D plan, your prescription drug plan. You can see all those other counseling-based preventive screenings. You may kind of like the dementia screens, you may not really know you're getting them, but your physician is getting to those to see if anything triggers the need for follow-up. A minute ago, I mentioned Part D covered vaccines. This is the prescription drug part of Medicare. For the list of Part D medicines, they are covered usually at the drugstore or a clinic, maybe if they have an outpatient thing going on or a drive-through vaccine, just to make sure that they accept your Part D as well as your Part B. But Part D typically covered vaccines are shingles. Now, shingles has always been covered by Medicare since there's been a vaccine, but it used to be really expensive under most Part D coverages, like a couple $100, and it's a 2-shot deal. So that was a lot of money, and a lot of Medicare beneficiaries just kind of skipped the old shingle shot. But since 2023, by way of the Inflation Reduction Act, shingles vaccines are free, both of the shots. So everybody roll up your sleeves and get your shingles shot. Also, DPT, the Tdap vaccine is covered. No copay, no coinsurance, no deductible. And Hep A and the low risk folks for Hep B. RSV, that's that respiratory syncytial virus. I could be pronouncing that wrong. That's it can affect children and babies and middle-aged people and older adults. So there is a vaccine for that, and it is free under Medicare. And when the CDC comes out with other vaccines that are needed, they will be covered under Medicare as well. Melanie, did you have something?
Yes. So I just got a question texted in, and with some of these vaccines covered under Part B and some of them covered under Part D, I just had a client that I've worked with before. He just texted and asked, he goes to his local health department and gets some of these vaccines. So to make sure that they are billing and running his Medicare appropriately, what cards should he bring with him?
What cards?
Yes, like what health coverage cards should he bring with him?
Yeah, assuming he's on Medicare, he takes his Medicare card, the red, white, and blue Medicare card. Also, unless you're on a Medicare Advantage plan, you'll have a prescription drug, a Part D card as well. So the thing to look at there in the lower right-hand corner of the Medicare Part D cards, it'll say Medicare R with a little X, meaning prescriptions. So those two things. And if you have a Medicare Advantage plan, then definitely take that Medicare Advantage plan, because most of the time that wraps up your medical, Part B and A services, as well as Part D. So what I just tell folks is take all your cards and lay them all out there, and they will make sure that they can check all the different types of insurance you have. And really that goes for folks that are not on Medicare too. Just make sure that your provider knows of all the different kinds of insurance that you have. Because, while you can unring the billing bell, it's easier just to get it right the first time around. All righty. So, if you are a little nervous and you don't want to sign up for tests unless you for sure know that they're covered, you can go right to the Medicare.gov website. Make sure you're on .gov. We also have a Medicare and You handbook that Medicare beneficiaries get an updated handbook every year. But if you've misplaced yours or you want an extra one, we do have some 2024 versions in our office, and we're happy to send you one. You can also call your Part D plan or your pharmacy because they'll have your information about your Part D plan, and they will be able to tell you. I know when I got my COVID vaccines and my shingles shots at the drugstore, I showed them all my insurance cards and I said, make sure these are free. And they came back with, yep, they're going to be free. If you have an Advantage plan, just call your Advantage plan. They have really nice customer service folks, and they can verify your coverage for you. Now, sometimes things happen and mistakes are made. And this is where everybody has to be a good detective and a good consumer of Medicare services. So if you have a Medicare.gov My Medicare account, then you can look to see what all the services that Medicare has paid for you. If you don't, then every quarter, you'll get something in the mail, a Medicare Summary Notice, MSN. And that lists in a paper variety all of the services that Medicare has paid for you. So you can check out to make sure that the services that you received are the services Medicare paid for. And if something looks a little funny, you can call the provider to see if you can straighten that out, or you can call our friends at the Senior Medicare Patrol. They are our sister agency, and they are all about detecting and preventing Medicare fraud. And their phone number is listed here, 317-205-9201. So feel free to call the ladies over at Senior Medicare Patrol if that's something that you're having problems resolving on your own. Just a reminder that there are programs out there that can help folks who have a little bit lower income and a little bit lower assets. And they could help pay for all the Medicare costs that aren't covered or that there are co-pays or co-insurances for. They could cover your Part B monthly premium. Most folks are paying almost $175 a month for Part B these days. And there's another program that helps you lower the cost of your prescription drug benefit, whether it's the monthly premium or the costs at the point of service, the drugstore. So SHIP counselors can help you figure out if you may qualify for those. And we're also very happy to help you with the applications. Super easy. And you can contact us in several different ways. We have some wonderful coworkers who staff our helpline at the office at that toll-free number. You can check us out on our website and all of our social media followings. We know if you're watching this on Facebook, you're already a friend. And here are some other resources that offer some information about health and wellness for Medicare beneficiaries. Okay, it's time for the wrap up, unless we have other questions, ladies. Okay.
Are there any other questions, Melanie? Nope. Okay. Thank you, Susan. Preventive presentations that we do. It's one of my favorite. Lots of good information. Thank you for that, Susan. And what is coming next? So we have one more Facebook Live for August. I can't believe we're going into September, ladies. I am looking forward to the cooler weather. I love my hoodies, but anyway, so we will be back on Monday, August the 19th at 10 a.m. Eastern to talk about one of our newer series that we have introduced, Medicare and Friends. So we are going to be talking about employer insurance, retirement insurance, and other coverage, healthcare coverage coordination like COBRA, how they interact or may not interact with Medicare. So that will be a great live to either watch or to come back and watch the recorded session if you have to work and have employer coverage during that time. We, just like this session, will be on YouTube, and it will be recorded on our Facebook Live. So without further ado, we are going to wave you all goodbye, and we will see you next Monday. Bye, everyone.